Welcome to the Deep Dive. Today we're digging into a corner of healthcare tech that's maybe not always in the spotlight, but it's really reshaping diagnostics globally. We're talking about the Radiology Information System market, or RIS. And, well, the numbers we're seeing here, they paint a pretty fascinating picture of where medicine is heading.
Yeah, we're looking at data from cognitive market research, and it shows the global RIS market pulled in, close to $1 billion in 2021. $986.69 million to be precise. But here's the kicker. It's projected to hit over $3 billion by 2033.
That's right, 3,024.47 million.
Which reflects a compound annual growth rate, CAGR, of almost 10%, 9.784%.
Exactly. And that kind of growth, year over year, tells you something significant is happening. For anyone maybe not familiar, an RIS, a Radiology Information System, it's basically the command center for a radiology department.
Okay.
Think of it managing, well, everything. Patient scheduling, tracking exams, radiologists reporting results, even billing. It's changing how that crucial data gets handled, analyzed, shared, everywhere. So understanding it is key to seeing the bigger picture in diagnostics and efficiency gains.
Absolutely. And this growth, it isn't random. It's really being pushed by, I'd say, three main things.
Which are?
First, just the sheer increase in healthcare infrastructure globally. Second, this relentless move towards digital everything in diagnostics. And third, a growing realization everywhere of how much efficient data systems matter for patient care.
Right, it's about smarter healthcare.
Smarter, more joined up, and ultimately easier for people to access.
Okay, so let's break down that growth, because it's not happening the same way everywhere, is it? You see some real hotspots.
Definitely not uniform. Let's start with North America.
Makes sense. Big market.
It is, valued around $485 million back in 2021, and it's expected to grow to over $1.4 billion by 2033.
Wow, almost tripling.
Yeah, with a CAGR just shy of 9.5%. So still very healthy growth.
And the U.S. dominates there, I assume.
It does, projected to hit about $1.15 billion itself by 2033. But what's also interesting is Canada. Their CAGR is actually higher, over 10%. Growing from $48 million to about $155 million.
What does that usually point to? Stronger government push, maybe?
Often, yeah. It can suggest significant public investment in digital health integrating systems. Mexico showing solid growth, too. $42.7 million up to $128 million. So the whole region is moving.
Okay, let's hop across the pond to Europe, then. What's the picture there?
Europe's interesting. It started at about $185 million in 2021, and it's forecast to reach over $530 million by 2033.
So also significant growth.
Definitely. And what stands out is you have established economies like, say, Germany, going from roughly $45 million to nearly $137 million. The UK from about $29 million to $86 million. Big jumps.
And it's not just the giants, right?
No, exactly. You see smaller economies like Sweden heading towards $27 million. Even Luxembourg projected over $3.5 million by 2033. It shows this drive for digital efficiency is really continent-wide.
Unified push, seems like.
Now, moving over to Asia-Pacific, the APAC region. This is where things get, really dynamic.
Okay. How so?
Highest regional CAGR. We're talking over 11%.
11%.
Yeah. The market size is expected to explode from around $174 million in 2021 to over $610 million by 2033.
Incredible. Who's leading that charge?
China's a huge part of it, of course, projected to go from $50 million to over $180 million. But get this, India has the highest individual country CAGR in the world here.
Really?
Over 12%, growing from $22 million to nearly $87 million.
Wow. What's driving that specifically in India, do you think?
It suggests some serious digital leapfrogging in healthcare infrastructure, huge population needs, increasing investment. It's a perfect storm for rapid adoption.
Makes sense.
And you also see very strong double-digit growth in Japan, South Korea, Australia, Singapore rising to almost $17 million, Taiwan to nearly $30 million. Everyone's getting on board.
Okay, let's swing down to South America, still seeing strong growth there.
We are indeed. A steady expansion. Sales projected to go from about $53 million in 2021 to $170 million by 2033. That's a CAGR of over 10%.
Another double-digit region.
Right. Brazil leads the way, expected to hit around $62 million. But what's notable is that most other key countries, Argentina, Colombia, Peru, Chile, they're also growing at over 10% CAGR.
So widespread investment across the continent.
It really points to a concerted effort to modernize diagnostics for more people.
And the Middle East, how does it fit into this picture?
The Middle East market, valued around $50 million in 2021, is forecast to climb to nearly $158 million by 2033.
Tripling again.
pretty much. Countries like Saudi Arabia, Turkey heading towards $35 million, the UAE growing from under $8 million to over $26 million. Qatar, too. They're all showing strong growth.
Reflecting broader modernization efforts there.
I think so. It aligns with national strategies for economic diversification and boosting healthcare services through digital transformation.
Okay, and finally, Africa. Sometimes overlooked, but crucial.
Absolutely. And the RIS market there is set to grow significantly, too, from about $38.5 million in 2021 to almost $120 million by 2033.
And the growth rate.
Just under 9.4% IGR. Still very strong. South Africa leads, projected to reach over $50 million, with Nigeria following at around $21–22 million.
So it's building a foundation.
Exactly. It signals that foundational digital healthcare infrastructure is being laid down, which sets the stage for, even more growth down the line.
So when you step back and look at all these regions, North America, Europe, APAC with that incredible growth, South America, Middle East, Africa, often double-digit growth, especially in emerging economies. What's the big takeaway?
Well, it really brings up an important point, doesn't it? What does this widespread acceleration mean for you listening to this?
Right.
It signals this undeniable global shift. We're moving towards healthcare diagnostics that are more digitized, yes, but also more interconnected and just fundamentally more efficient.
It's not just software upgrades.
No, it's deeper than that. It's changing how critical medical imaging data flows, how it's analyzed, how it actually helps in patient care, and that's happening everywhere.
So, wrapping this up, the radiology information system market, maybe not a term everyone uses daily, but clearly it's a powerhouse. It's driving a significant part of healthcare's future globally.
Definitely a powerhouse. A quiet revolution, maybe, but one that's really gaining momentum. And just to summarize the why, again, this robust growth, especially where we see it booming in places like Asia Pacific and Latin America, it comes back to those core drivers. More healthcare facilities being built, the digital wave washing over diagnostics, and this growing understanding that efficient data management is just critical.
Good data leads to better care.
Precisely. And knowing about this trend, understanding this specific area of growth that's valuable, it highlights a fundamental shift in managing medical imaging worldwide.
So for you, our listener, here's something to maybe think about. With these projections showing such strong growth and healthcare becoming more digital by the day, how might the evolution of these RIS systems change your experience or the experience in your community when it comes to diagnostic imaging over the next, say, 10 years? What new possibilities open up when radiology data becomes this connected and digitized?
Welcome to the Deep Dive. Today, we're really unpacking the forces shaping medical tech's future. And we're zeroing in on something critical, but maybe a bit behind the scenes. The Global Radiology Information System market. RIS, as it's known.
Right.
It's not just software, is it? It sounds more like the control center for diagnostic imaging, booking, reports, everything.
Exactly. And it's becoming absolutely essential.
Yeah.
What's really fascinating now isn't just that it's growing, but how and, what that growth really implies for healthcare.
Okay.
So today, we'll explore what's pushing RIS forward, the bumps in the road it faces, and the really cutting-edge trends reshaping care delivery for you around the world.
Okay, so reports like the one from Cognitive Market Research show significant expansion. Let's unpack that. What's really driving this growth? What's pushing it?
Well, the biggest, most immediate factor is just the huge increase in demand globally for diagnostic imaging.
Okay.
Think about more chronic diseases, aging populations, especially in places like North America, Europe, Asia Pacific.
Right, so more scans needed.
Way more. We're talking an explosion of X-rays, CTs, MRIs every single day. And RIS is what helps manage that flood. The streamlined scheduling, keeps track of patient data, manages the results, archives them. It's basically crucial for handling that rising volume efficiently and making sure you get timely, coordinated, high-quality care.
That makes total sense. More demand, you need a better system. But okay, beyond just handling more images, what's the next big force at play here? How are these systems changing?
That would definitely be the global push for real interoperability, getting systems to talk to each other properly.
Ah, okay, integration.
Exactly. It's not just connecting RIS anymore. These platforms are being deeply integrated with PACS, that's picture archiving and communication systems, and critically, electronic health records, EHRs.
Right.
And the key thing here isn't just a basic link. We're talking robust APIs, standard protocols like HL7 and DICOM, making sure these different systems actually speak the same language.
So it creates a unified record.
Pretty much. A single, cohesive patient record for you. accessible across different doctors, different hospitals. That means better collaboration, smarter decisions based on your full history, faster access to your imaging.
So RIS is becoming this central hub linking diagnostics. Sounds powerful. But systems like that must have challenges, right? What are the main obstacles?
Oh, absolutely. Progress always has hurdles. The biggest one, honestly, it's the high cost of putting these RIS systems in place.
The cost factor.
Yeah, it's not just buying the software. You've got hardware, IT support, and importantly, a lot of ongoing training for the staff.
So it's a big investment.
Very big one. And those financial barriers, they can really slow things down or even stop adoption completely, especially for, say, smaller clinics, maybe regional hospitals or healthcare facilities in developing countries.
That's a major hurdle. Does that mean the benefits don't always outweigh the cost, at least initially?
Well, that's the tension. The long-term benefits are definitely there. Better workflow, smoother patient coordination, improved diagnostics.
Yeah.
They make the investment worthwhile over time.
Okay.
But overcoming that initial hump is tough. The good news is the industry is looking at ways around it.
Yeah.
Things like cloud-based models, different payment structures, maybe even cooperative purchasing to make it more affordable.
Right, shifting the cost model. Are those cloud solutions really making a difference, though? Or is it just moving the expense around? What's the reality for those smaller places?
That's a really good point. It does shift the cost from a huge upfront capital expense to more predictable operational costs, like a subscription model almost.
Okay.
And that can make advanced systems accessible to clinics that just couldn't afford the old way. So yes, it is opening doors, but you're right, facilities still need to weigh the total cost over the long run. It's not free money, but it is creating new pathways.
So the challenge itself is kind of driving innovation in a way.
That's interesting. Okay, moving past the challenges then, what about the future? What are the really exciting breakthroughs happening right now?
Well, one massive trend is the rapid shift to cloud-based RIS platforms.
We just touched on that for cost, but what else?
Beyond cost, it offers incredible scalability. You can expand services easily, and remote access is huge. Think outpatient clinics, diagnostic centers, hospital networks with multiple sites.
Right, accessing data anywhere.
Exactly. And vendors are now building cloud-native systems. These allow real-time collaboration, have built-in disaster recovery. Imagine, like, a clinic in a storm-prone area, their data is safe and accessible off-site. That's huge for resilience.
Resilience and agility. Okay, that makes sense. So cloud is big. What's next in terms of maybe making the system smarter, improving accuracy or efficiency?
That brings us squarely to AI, artificial intelligence and machine learning integration into RIS.
Okay, AI is everywhere. How does it help here specifically? Well, it's already starting to automate routine tasks, speeding up report generation. But the really transformative part, it's enhancing the actual image analysis.
How so?
AI can help detect subtle anomalies, maybe things the human eye might miss initially, or just provide a second check. It can potentially improve diagnostic accuracy for you.
Interesting.
And it also helps with a growing problem, radiologist burnout. By taking on some of the more repetitive tasks in high-volume places, it frees up specialists.
So it supports the doctors, too. Makes sense. Okay, cloud, AI. What's the final big trend we should be watching? Maybe something that brings it closer to the user?
Precisely. It's the rise of mobile and web-based interfaces for RIS.
Getting it on phones and tablets.
Yeah, basically. Healthcare professionals now expect they need real-time access to reports and records wherever they are.
Right.
So web portals, mobile apps, they let radiologists, physicians review cases, update records, collaborate remotely, whether they're down the hall or, miles away.
So it's all moving towards a more decentralized digital model.
Absolutely. It makes your medical information more fluid, more accessible, and better integrated into your whole care journey.
This has been really insightful. So we've seen the global RIS market is really changing, driven by diagnostic demand, the crucial need for interoperability, and these powerful new technologies like cloud, AI, and mobile access.
Yeah, and if you zoom out, look at the bigger picture. What's really striking is how all these tech advances in RIS, even with those cost issues we talked about, are fundamentally changing how fast and how well you get diagnosed and treated.
Right.
It's pushing healthcare towards being genuinely connected, much smarter, and definitely more focused on the patient.
A more patient-centric future.
Exactly. Which leads to a final thought for you, the listener. What new possibilities does this open up? How might you interact with your own medical data, your own care, in the coming years, maybe gaining empowerment in ways we haven't even fully grasped yet?